Hi, I'm Ryan Bates. I'll be performing a cardiac assessment on you today. How are you feeling?
I'm feeling good, thank you.
Awesome. First, we're going to start with kind of looking you over. Can I have you, we're going to turn your head just a little bit away. Perfect. I'm going to look with this light next to your neck, and I'm going to look and start with looking for carotid pulsations and noticing bulging of the jugular vein. See the carotid pulsations? I don't note any jugular vein distension. Let's go ahead and turn the other way. Awesome. This light kind of helps me see with the shadows. I see carotid pulsation. I don't see any jugular venous distension. Perfect. Go ahead and relax for me. Next, I'm going to take a look at the point of maximum impulse right about here and note if I see any pulsations, which I do. That's great. Awesome. Next, we're going to start with palpating. I'm going to start with your neck and work my way down.
Okay.
I'm going to have you just relax. I'll start with your neck. I'm going to feel the carotid pulse. I'm just going to use 2 fingers, one side at a time, and I'm going to feel for any thrills, which is like a vibration when, if there were to be something wrong, we would feel that in your carotid artery. I don't feel it on the right side. No thrills on the left side. Next, I'm going to move to your sternum and your ribs. I'm going to feel for the angle of Louis, which is where the manubrium, which is the top of your sternum, meets the body. And it is right here. So to the right of that is the aortic pulsation area. I'll feel here. It's second intercostal space to the right of the sternal border. Right. I feel pulsation there. And then to the left is the pulmonic pulsation area, to the left of the sternal border at the second intercostal space. And I feel normal pulsation there. Then we'll go to the fourth intercostal space to the left of the sternal border, and I'll feel for the tricuspid pulsation area. And I feel that there, that's normal. And then we'll go to the mitral area, which is the same as our point of maximum impulse, which I can feel the pulsation there, feels normal, that's great. And then next, I believe I'm gonna start listening to you. We're gonna do the same thing and all that. First, I'm gonna start with the bell of my stethoscope, which hears lower sounds. And we're gonna feel for what's called, or listen for a bruit, which is kind of like the noise of a vibration if something were to be wrong in there. So go ahead and hold your breath for me just for a second. I don't hear any bruise on the right side. Go ahead and hold your breath for me again. I don't hear any bruise on the left side, or nor do I do on the right side. So starting with the diaphragm, I'm going to listen in the same spots I palpated, okay?
Okay.
This one is going to be the aortic point. And then your pulmonic point. Tricuspid point, a little farther down at the fourth intercostal space, and the mitral point, which is the point of maximum impulse again, at the fifth intercostal space. All right, everything sounds good with the diaphragm. I don't hear any murmurs, no clicks, no S3 or S4, which are just extra heart sounds if something were to be wrong. I'm going to listen with the bell of my diaphragm now in those same spots. So let's start with the aortic. And then pulmonic, and these are the valves in your heart, the aortic, pulmonic, tricuspid, and mitral. Listening to those areas helps us to know how well they're working. If they weren't working very well, we would hear a whooshing, kind of like a washing machine, which means that the valve's not closing properly and blood is still escaping your heart. So tricuspid and mitral. Great. I don't hear any bruise or thrills. Next, what I'm going to have you do is I'm going to turn on your left side for me. Now I'm going to listen for that same kind of stuff at the sternal border and at the apex of your heart and kind of listen to see what we hear there, okay? So I'm going to start with the bell at the sternal border. All right, no extra sounds yet. Awesome. And with the diaphragm, let's listen to the left sternal border and the apex. I don't hear any S3 or S4, no murmurs, no clicks. I'm going to have you go ahead and sit up on here, and then I'm going to listen as you're hunched over, and have you take your arms off to the side here. And then I'm going to have you take a big deep breath and exhale, and when you exhale, I'm going to be listening at these two spots. So exhale, and I'm going to be listening for a different type of murmur. All right, so big deep breath in and exhale. Awesome. Big deep breath in and exhale. All right, no extra sounds with the diaphragm. Let's start again at the left sternal border and exhale. Great job. And same thing again. All right, awesome. No murmurs with the diaphragm or the bell at the apex or the left sternal border. Next, I'm going to start with inspection. I'm going to start with your arms. I'm going to take a look. I notice that your veins appear slightly bulging out. We've got you sitting up. They look normal in color. I don't see any extra paleness or flushing of your skin. Your skin is warm. Your capillary refill, I'm going to have you turn your hands over for me. And capillary refill is normal with 2 seconds. I'm going to feel for your intraocular. I all of a sudden have forgotten the name. Yeah, epitrochlear nodes, sorry. There's that. I don't feel those distended or swollen at all. Those help drain kind of like it does from your neck, but from your arms to your body. Now let's feel your pulses, your brachial. Brachial pulses are 2+ bilaterally, and then we're going to start with your radial. Radial pulses are 2+ bilaterally, and then ulnar pulses. Ulnar pulses are 2+ bilaterally. Everything looks good. Just one more thing I have to do. Your nail beds are pink right now, so is your hand. I have to test the arteries. I want to see and make sure that if one were to be occluded, the other one, there's 2 arteries right here, that the other one could deliver enough sufficient blood flow to keep your hand alive. So what I have to do is I have to occlude both arteries. And then your hand's kind of turning pale, right? Mm-hmm. So I'm going to release the radial artery and keep the ulnar artery occluded. And I'm going to look to make sure that your hand kind of pinks up, which it is. That's great. That means that your radial artery has sufficient blood flow. Let's try this on your right arm and give your left hand a break. We'll do the same, and then I might have to lift it up just to help get it a little paler. Awesome. I'm going to release the radial artery, and there. And then you see how it kind of pinks back up. Mm-hmm. Great. That means your radial artery is good. Let's start over here, and we'll do the same, but we'll release the ulnar artery once your hand loses a little bit of color. All right, ulnar artery released, and we are pinking back up. Great. If you feel a little bit of numbness or tingling, that's all right. It's just us playing around with your arteries. So, hands pale, right? Yep. Awesome. And then we'll release the ulnar artery and pinks back up. Great. I'm going to have you relax again, and we're going to do your legs, okay? Okay. Alrighty. So, same kind of deal with your legs. I am going to look at the color. Looks like we are no pale spots, no flushed red, warm, or swelling spots. We've got a normal hair pattern, which is great. You're not cool to the touch, nor are you hot to the touch. Your nail beds are pink with capillary refill of less than 2 seconds bilaterally, which is good. Next, what I've got to do is I've got to feel your pulses, okay? I'm going to have to start with your femoral pulse, which I'm going to put my hand underneath here with And I will feel okay. Make sure all of the pulses are going, and I'll work my way down, okay? Be a little uncomfortable, but I'll be quick. While I'm palpating, I will also feel for the lymph nodes in there, okay?
Okay.
All right, so... All right, I feel your femoral pulse on the left. It's 2+. I don't notice any inflammation of your inguinal nodes. Next is the right femoral pulse, which I feel as a 2+, and I don't know any swelling of your inguinal nodes, which is great. Next is behind the knees. That's your popliteal artery. Sometimes it's a little... There we go. All right, popliteal artery is 2+. Awesome. And then we're going to do the posterior tibialis, which you've actually got a lot better than I have felt before. You've got 2+ posterior tibialis pulses, which are great. And then we'll do the dorsalis pedis. And those are 2+ bilaterally. And then just to check for any pitting edema, I'll keep my fingers pressed down for about 5 seconds. I will release and make sure that there's no literal pits left behind. Would you have any numbness or tingling in your extremities down here?
No.
All right, great. Next, what I'm going to have you do is I'm going to elevate your legs about 60 degrees. And then we're going to wait for your feet to kind of pale. That's about as close to 60. Let those pale. It's going to take about a minute. And when they do that, we're going to have you sit up, and we'll test to see how well or how quickly your feet kind of turn pink again, and then those veins on your feet fill up, okay?
Okay.
All right, so... just give it another minute. Your legs doing okay?
Yep.
Okay. All right. There's that. All right, I'm going to pull this out, and I'm going to have you sit up on the couch, please. And then we're going to take a look at your legs. They are pinking up nicely. Do you see that?
Yep.
Awesome. And then within 10 seconds, they should be turning pink again. And then within 15 seconds, we should see your veins kind of pop out. And you have nice veins on your legs and arms and hands, and those are filling in nicely.
Okay.
And next, I'm going to have you stand up, and I'm going to check the look to see if you have any like varicose veins, anything like that, okay?
Okay.
So go ahead and stand up. And then look at the right leg. No varicose veins. And then your left leg. All right, let's rotate that outwards. Awesome. And then rotate inwards. All right, that looks good. No varicose veins. You can go ahead and have a seat. Thank you.